Thank you, Michael. Appreciate it. So in the spirit of what Carol said, it really is my privilege to have this presentation today. Being the Chief Executive of Mental Health Partners, I can tell you how literally important this subject is. You know, my first is thanks to this club and its leadership, and to Michael and to Carl and the program committee and the people that serve on it, and the fact that this board and this club really wants to make a difference in educating us to things that are critically important, and as Carol said, to make the world better, to make a difference, and certainly to make our community better. One of the things that I want to make sure we emphasize as Matt makes his presentation, you should know he spoke here on Monday night and literally hit it out of the park. He's passionate about this as I am, and he really has a wonderful message for all of us. But I would also say that on your tables, there's a flyer, and if there's not there, there's one over on the table. And it's certainly my passion and to make sure that you understand that all of us can make a difference in saving lives and preventing suicides in our community. We've been on that campaign this whole year. In terms of our 4,098 as a campaign, we had 683 completed suicides in Boulder and Broomfield County over the last 10 years. We made it an absolute objective that in this year alone, we were going to train 6 people for every one of those. And I'm here to announce that we've now trained over 1,400 people in QPR suicide prevention training. We just finished the Boulder Police Department, including the chief. We're working up at the university through Marty Evans' good work with all of the staff that are facing students. There was an article in the New York Times this morning about how important it is for adolescents and teens. You should know that suicide is the 10th leading cause in the United States of death. It is the highest leading cause of death for adolescents and teenagers. This is a serious important effect because literally all of us can save lives. I want to see that every one of these our club members takes QPR training. Bobby would certainly, as we did the training here for a lot of the people working with kids, can tell you how important that is. And if you want to sign up your business, your group, as an individual, we're going to be doing during Mental Health Awareness Month in May. We're going to be doing that in each of our communities and inviting any of the public, because every one of us someplace in our lives, in our lifetime, are affected by these type of tragedies, and we don't need any more. So Matt, he's a public health guy just like I. He did his master's degree in Minnesota in public health. I did mine in Berkeley, and I told Matt Monday night, could you just get this Minnesota weather out of here because we want to warm up a little bit? But be that as it may, he's got a wonderful story, he's got a wonderful message, and if he doesn't make a difference by the end of this talk, I can tell you that you didn't get enough sleep last night. So Matt, come on up.
Thank you for the very kind, unnecessarily kind introduction, and thank all of you for having me here today. 31 years ago, the Rotary Club in my hometown in St. Louis gave me a scholarship, and so it's taken me a while to be able to give back and say thank you, but I'm glad that that's finally able to happen today. So, I do have to say I'm a little bit confused though, because when Michael was doing the raffle, he pulled out the ticket and he simply read off a list of numbers, and I'm not really seeing where that would take an hour of training to do online, but maybe y'all are just a little bit more dense than I thought. So I can do the training for you in about 30 seconds if you want me to do that. So just let me know, I'm happy to help. So the Pope, the President, and the top university professor in the world were all in a plane crash and crashed into the ocean, and this didn't really happen. And they swam to the life raft that was there, and they realized after they got in that it was only big enough for 2 people, and it started to sink. And so they said, one of us is going to have to get out and get into the ocean. And the Pope said, well, you know, it's I'm the spiritual leader of the largest church in the world, and you know, my flock needs me, so I really should stay in the boat. And the President said, you know, I'm the leader of the free world and the most important person on the planet and the most powerful, and so I really should stay in the boat, and the university professor said, well, I've prepared a PowerPoint about why I should stay in the boat, and the Pope and the President jumped out and swam off into the ocean. Which is my way of saying I'm not going to inflict PowerPoint upon you today. I'll show some mercy, yeah, for once. My journey with mental health really began when I was a young kid growing up in St. Louis, and I had an Uncle Jim that we never really saw very much. Uncle Jim never came to the house. He was rarely invited, and he was rarely talked about. And I would hear my mom use the phrase occasionally manic depression when she was talking about him, which I didn't realize until many years later was actually bipolar disorder. But we didn't talk about him. We didn't talk about the mental illness. I didn't know what it meant. None of my brothers and sisters knew what it meant. But we heard my mom say things like Uncle Jim is loony, he's a nutcase, he's a lunatic, he's batshit crazy. And we heard these words and phrases growing up, but that's really all we knew about him. And then I found out many years later, we had gone to his funeral, but I didn't know until many years later that he had actually died by suicide, because we never talked about that either. And so as a kid growing up, the message was really, really clear. Mental illness was bad. It was something to be ashamed of. It was people who have mental illness were, the other, they were loony, they were nutcases, and you certainly did not talk about it, and you did not talk about suicide. And those messages were very, very clear for me and my brothers. So you can imagine how hard it was when I was in college and I started to exhibit early signs of bipolar disorder myself and had my first manic episode and my first depressive episode. So I learned, my lesson growing up, and I buried that stuff as deep and far away as I possibly could. And for many years, I did great. I did great at managing it, burying it, hiding it from everyone in the world. And I had a life that on the surface was really great, and it was very conducive to hiding mental illness. As a college student, everybody's drinking a lot. And people didn't, bat an eye at it. They didn't realize that I was doing it as a way of medicating my illness and trying to cover up my misery. Later on, when my wife and I got married in Minnesota and then moved to Denver, I had what on the surface was a really terrific life. We had our first child, we had a dog, we had the house in the suburbs. Everything was just really great. And I had a great job working for the University of Colorado. And by all outward appearances, life was great, but it was just a veneer and a facade. The truth was that I was about as miserable as a human being could get. And I would find myself crying myself to sleep at night, drinking myself to sleep at night. At work, I would often close my door and start to cry, or just stare at the wall and not do anything productive. And the reality is that I was a complete and total mess. I was also working evenings as a stand-up comedian, and that provided the best cover of all for having depression. One, because you just blended right in. If there wasn't bipolar and depression, there wouldn't be stand-up comedy, I can tell you that for sure. Because the thing is that people don't realize about that is that there's a big difference between being funny and being happy. And I was really funny. I was actually very, very good at it, and I enjoyed it. And I was miserable, and so were all of my other peers in comedy. And it was a very hard place to be and not very supportive because everybody was dealing with it the same way, making fun of it, trying to hide it from people, and drinking and doing a lot of drugs. When I finally started to lose control of the depression and found that every depressive episode would be deeper and deeper and deeper and last longer and get darker, I realized that I was starting to develop a pretty unhealthy coping mechanism, which was thinking about suicide. And I found that suicidal thoughts and ideation actually became comforting for me, which sounds really strange. But I knew that in those most painful moments of my life, that I could take my life and I could end it all. I could have a little hammer and I could just break the glass and pull the lever and it would all be over and all of my troubles would be over. And that's the thing about suicide that people don't always realize. That people who die by suicide don't want to die. That's not the intent. The purpose of suicide is not death. The purpose of suicide is pain relief. And people get to a point where they are in so much pain and they are hurting so bad and they have lost all hope, and they truly believe in the deepest part of their heart and their soul that the only way to end that pain is to take their own life. And that's where I was. I really believed it. And so it went from just thoughts and ideation to planning. And I started to think more and more about it and realized that, yeah, this is probably how my life was going to end. The number one destination for suicides in the United States is the Golden Gate Bridge, the number 2 in the world, actually. There's a bridge in China over the Yangtze River that has even more. But the Golden Gate Bridge has, somewhere, give or take, around 2,000 suicides that have taken place. But there's also been a number of people, not many, but around 30 or so that have survived the jump. And a number of years ago, they tracked down as many of them as they could and interviewed them. And every single person said the same thing, that the second they left the bridge, they regretted it. And on the way down, in those 4 seconds that it took from the bridge to the bay, they said, what the hell am I doing? My problems weren't this bad. I didn't have to do this. I heard one of those people speak at a fundraiser, and he told the story of the day that he jumped, and he said he was on the bridge, and when he was taking the bus there, it was a beautiful Saturday, and he told himself, if one person asks if I'm okay, I won't do it. Just one person that didn't have to solve his problems. He just wanted somebody to say, are you okay? And he spent about an hour pacing back and forth on the bridge. He was crying. Nobody said anything to him. And finally, a woman tapped him on the shoulder and handed him her camera and said, will you take my picture? And he said he realized at that moment that nobody cared and nobody gave a shit about him. So he posed her with the city in the background, took her picture, handed her the camera, and went right over the edge. Now, the point to that is, again, what I was saying is that the purpose of suicide is not death, it's about pain relief. And all people are looking for is just a little teeny tiny bit of hope. So fast forward to my story. I eventually, things got so bad that I picked a date and I wrote a note, and then I went to a sporting goods store and I purchased a gun. And I planned it all very carefully, that I was going to drop my son off at daycare and then go home and take care of it in my basement. And by the grace of God, when I got home, my neighbor Lucille was out gardening in front of her yard, and she saw me crying because I had just said goodbye to my son for what I assumed would be the last time in my life. And she came up to me and stopped me, and she said, what's wrong? And I said, nothing, and I'm fine. I just had some stuff I'm dealing with. And she said, no, you're not okay. And I said, yeah, I'm fine. And she was persistent. She wouldn't let it go. And she finally said words that were like a slap in the face to me. She said, are you going to kill yourself? And I couldn't believe it. I didn't know how she knew, how she could tell. And she said, I've been watching you for a while, and you've been slipping, and I've been really worried about you. Are you going to take your own life? And I said yes. I was so stunned that I just blurted out the answer and told her yes. And she said, no, you're actually not going to do that. And she was very calm. She was in her 70s. She's since passed. But she saved my life, and she convinced me to go with her to the hospital and get help. And then I started a very long journey, and an often painful journey to getting better. She helped me realize that there was hope in the world, that I had deluded myself into thinking that nobody cared. And she helped point out all the people that did care and all the people that would matter if I lost my life. But I had become very good at hiding it. And I'm not the only one. I mean, this is a very universal thing. I made a new friend this morning who was telling me about her nephew, who was just short getting ready to graduate from a top university in the country. Everything from his standpoint looked great. You know, here he was going on with the rest of his life, and he took his life. And so it's easy to beat ourselves up and say, I've lost friends. You know, I've had friends that I've lost to suicide who I saw that morning. And it's so easy to beat yourself up and say, I missed it. But we've become very, very good at hiding it from the world. But when you recognize those warning signs and ask someone, it can be that slap in the face. And most people will tell you, if you ask them directly, that yes, they are suicidal. And that's why I want to thank Hans and what Mental Health Partners is doing in Boulder to train as many people, because I owe my life to that kind of training. So thank you all for that. Being suicidal wasn't my rock bottom. My rock bottom actually came when I tried to access help in our mental health system. And as many people who have tried to access help have experienced, you know that what faces you when you try to access help is a lot of obstacles that stand between you and the great care that's out there and available. And many people find very, very long wait lists, or you find providers that don't take your insurance, or they don't talk to the other providers. Your psychiatrist isn't in contact with your primary care provider or your therapist, and you have this uncoordinated care. And the system is very often, even though there's great providers, it's very often set up to keep people from getting better. The other problem is that we wait until people are very sick and then scramble to find them care in a system that just doesn't have the capacity to do that. It's like driving on I-70 up to the mountains on a beautiful powder day on a Saturday, and it's jammed. There's just too many cars and not enough lanes. And we have too many patients seeking care and not enough providers. And there's a number of things that we can do, and there's hope in this story. And that's why I founded the National Mental Health Innovation Center at the University of Colorado, to say we have to think differently about mental health. We have to not just rely on therapists and psychiatrists. They're incredibly important, but they can't solve this alone. We have to think about prevention the way that we do in every other aspect of medicine. In cardiology, we spend so much time, your doctors tell you, you got to eat better, you got to exercise more. Trust me, they say these things. And we think about prevention, not just waiting until people get sick and have a heart attack. But we haven't done that in mental health. The idea of mental health as a public health issue is really brand new. There's only 5 public health programs in the country that have a master's concentration in mental health. There's almost 150 that have that same concentration in cancer. So what are we doing about it? What are some of the things that we're doing at our center? And I just want to highlight a couple of those because I know I don't have a lot of time. And one of the areas that we're most excited about is in the realm of technology. And we are working a lot with the tech industry, and in particular in the virtual reality. How many people have tried virtual reality here? Okay, and of those, how many tried the kind with the cell phone? Okay, so that's not really what we're talking about. We're talking about more robust virtual reality. And it turns out that there's over 30 years of research showing that virtual reality can be incredibly effective at preventing and treating all kinds of mental health and doing behavior change. And I want to give you a couple examples of those. One of the areas where there's tremendous potential and there's been great results is in using virtual reality to treat PTSD. Our colleague Skip Rizzo at USC has developed a virtual Iraq and virtual Afghanistan to treat vets who have come back from war and are traumatized by combat-related events. And the goal for him was to say, can we have a platform that helps people identify their triggers? What is it that's setting off their PTSD? And I'll give an example. This is a published case study. There was a gentleman who came back from his time in Baghdad, and they brought him, his family, he came back to LA, and they said, we're going to bring you to Palm Springs to celebrate coming back. So he went with his wife and kids to Palm Springs. And when they got in there, he was driving. He pulled the car over suddenly, got out, and ran off. He had this massive panic attack. They couldn't find him for almost 16 hours. When they finally did find him, he was shaking, he had his shirt off, and he could barely talk, and they didn't know what was going on, so they brought him back to Los Angeles, and the therapist couldn't figure out what had triggered that panic. And so they brought him to Dr. Rizzo's lab, and they put him in a virtual environment where that brought him back to Baghdad. And they could put him in a number of different scenarios that he might have been in a convoy, on foot patrol, out in the desert, in a crowded Baghdad market, in a sandstorm at night during the day, and they went through all these scenarios, and while he was wearing biosensors. And they then put him in a grove of palm trees, and his heart rate shot up, and he started to panic. And they said, okay, there's something here. And it turns out that what touched off his panic was palm trees. It wasn't something related to a gun or anything like that. He saw 2 trees that were crossed like this and remembered a memory that he had buried about when his convoy got attacked and a friend of his close buddy who was 2 cars back, got killed. And so he saw palm trees when they were on vacation, and his brain went into fight or flight and said, you're not safe, you're gonna die. And so he panicked and ran off into the desert and was gone for 16 hours. Well, once they knew that trigger, then the therapist could do their job and start to treat it through traditional talk therapy and helping him to realize that when he does see palm trees or sees trees that are crossed, it doesn't mean he's gonna die, it just means he saw some trees. And he was able to get better because of that. The amount of time that it took to identify that was just minuscule compared to what it might have taken to do traditional imaginal therapy where he was closing his eyes and trying to realize what was going on. Another area, just showing the power of VR, is an early study that they did at Stanford where they had 2 groups of people. And one group came up and they said, you're tourists and we're going to take you on a helicopter ride over the city and we're going to fly you around for 10 minutes. And then they had a second group that came in and said the city had to be evacuated because of a natural disaster, but a baby got left behind and you're a superhero and we need you to fly around and find the baby. And so for 10 minutes they flew around and eventually found the baby. And it turns out that on the way out, what they did for each participant is they accidentally knocked over the table that had all of the supplies and pencils and things on it. And it turns out that the people who were in the superhero group were twice as likely to stop and help, just from doing 10 minutes and feeling like a hero in this virtual environment. Well, that's pretty cool, but the really amazing part is that 2 weeks later, they had the participants come back to the lab to pick up their checks for being in the study. And they had another student standing out front of the building who they hadn't met before, and they pretended like they were lost and asked the people for help. And 2 weeks later, they were still twice as likely to stop and help. That the effect had been sustained even just from a 10-minute experience. Another one that they did in the same lab, they had two groups of people that read a passage about deforestation and the impact on the environment. One group then spent 10 minutes cutting down trees in a virtual environment, and then they tracked their paper usage for 2 months, and they used 20% less paper just from that 10-minute experience. So the point here is that VR, even in very, very small doses, can be incredibly effective. And now that virtual reality equipment is being made more widely available, that it's cheaper and that the quality is better, we're finally seeing some of those studies get turned into actual clinical applications that can benefit patients. I'll give the last example, and then I know that I'm about out of time, unfortunately. There's a tremendous application. There's several companies that have built platforms for helping people deal with paralyzing fears. Phobias can be simple things, like being afraid of spiders, and that might mean that you just don't go in the basement. But for some people, it can actually be totally debilitating. I had someone, when I was running the Depression Center, who called and said that she and her husband had been saving for their dream vacation when they both retired for years, and finally came around, and she was never able to get over her fear of flying, and they weren't going to be able to go to Greece. And she said, I know that there's a thing called exposure therapy where they gradually expose you to the thing that you're afraid of and do therapy around that, but I can't find anybody who will do that. Because really, it's hard enough to get a therapy appointment as it is, much less to find a therapist who's going to go to the airport with you every week, who's going to get on a plane with you every week. Good luck with that. It doesn't matter what kind of resources you have, you can't do it. Well, with this platform, now people are able to go to their therapist's office, put on the headset, and recreate all aspects of the trip. Because it's not just the being on the plane part that makes people panic. It can be starting to pack the night before, or the drive to the airport, or going through security, sitting at the gate, and the therapist can control all of this stuff from the therapy dashboard, make a storm roll in so that they know there's going to be turbulence on the flight, walk onto the plane, take off and land right in the therapist's office. And they found that for doing exposure therapy with virtual reality, that the results are about on par with what you would see from traditional exposure therapy, except that you can actually find people who will do it. Fear of heights, fear of dogs, fear of driving, fear of bridges, all of the things that keep many people from having the quality of life that they want to have or having the jobs that they want to have. Now those treatments are available to people. So there's really exciting stuff that's happening. I'm sorry that we don't have more time to talk about it today, but I would encourage everyone to check out our website, which is mentalhealthinnovation.org, or better yet, come to our center and try some of this stuff. We would love to have people come down and try virtual reality. The point to all of this, and the point that I really want to make, is that so much of my experience in my career and in my personal life has really been seeing what's wrong in the mental health system. And that became incredibly frustrating for me. And so when we started the center, my goal as a person, as a human, was that everything that I do, everything that our center does is going to be about bringing hope into a system that has really lacked it for so long, because we hear so many doom and gloom stories like mine, stories like everyone in this room has been touched by, stories like my Uncle Jim. And we can replace those hard, dark stories with hope if we're all committed to it, if we think differently and then we embrace things like prevention, early intervention, unusual in new novel technologies and new treatments. So thank you all very much for listening to me today. And thanks for your commitment to mental health. I'm supposed to do. Should I do a raffle?
You can go ahead and take a question or two.
Okay, great. Yes. Yes, sir.
You know, I'm not exactly sure where I'm even going with this question, but when I hear you talk, for me, my biggest concern is the young people. I mean, and you know, teenagers, and you know, I've got grandkids now, and I think of the world they're growing up in. I don't want this mic; it's echoing. There just seems to be so much stress on young people. And I don't know what as a society we can do about that. Because when you say, you know, the leading cause of death among young people is suicide, to me that's just such a tragedy, and somehow we've lost the joy of just growing up, and it's just all stress anymore.
You know, I have my own theories on that, and I think if you talk to, you know, 10 different people in the mental health world, you're going to get 10 different theories. But I really believe that when so many of us went through kindergarten, we basically had a year of therapy and didn't even realize that we were getting it. And, you know, we learned how to fail and bounce back from that. We learned how to put bad things into a context. We learned how to not overreact when people called us names or were mean to us, and then as we shifted our focus in this country towards all academic achievement, that really got tossed by the wayside. There just wasn't time for it anymore because we had to have, you know, people, you know, if you weren't reading Harry Potter by the time you were 6, then something was wrong with you, right? And so I think that that's a big reason, that kids don't have that foundation. And then you have this misguided love that so many parents have, and we want the best for our kids. And so as a result, we say, we're going to put all this pressure. You're going to get A's. You know, you need to go to Harvard. You're going to be a pro athlete. You see kids who are 9 years old with like personal pitching coaches. I mean, this is very, very common anymore, that they're specializing in sports and going on these travel teams. Anymore, there was an article in the New York Times recently about how many kids have 4.0 averages, lettered in multiple sports, were, you know, president of this club and that club, and didn't get into Harvard and didn't get into the top schools. And, you know, so you have these kids who are, they don't know how to fail. There's so much pressure on them to achieve, and the parents may not say it, but they say, we've spent all this money on these private lessons and everything else. Then they get their first B, or they don't make the varsity team, and their lives fall apart, and they don't know how to handle it. So I think it's on us, you know, frankly. And I think we you know, there's now a push to get social emotional learning back in schools. We need to do more of that and do a better job at it. And we got to go easier on our kids. I mean, you know, a B used to be a good grade, and it's not anymore. And so we got to change that and reframe things. That's my belief.
Matt, thank you so much. I get emotional because I heard you several times. What you say has touched our Rotary family. We have lost friends, family members, and you've given us hope, and we appreciate that. And in your honor, we would like to contribute 100 doses of vaccine to the Polio Plus Fund. As we like to say, we're just this close. We would like to say that also about mental health. We can be just this close.
That means
Thank you so much.